Good morning and welcome to Monday Mornings with Margie. I am really excited about the person we will be speaking with today. She is a psychiatric nurse practitioner. Her name is Cyllene Saintelien, and I am going to let her, Cyllene, introduce herself to us.
Okay, thanks, Margie. So I'm Cyllene Saintelien. I'm originally from Connecticut, New Haven, Connecticut, where I grew up. I'm African American. I married a Haitian American man. That's why my last name, Saintelien, but it used to be Holmes. That's my maiden name. And I've been in practice in mental health for probably over 15 years in various aspects, but mainly in the clinical realm for about 15 years.
Great. Well, I'm excited, to talk about this topic. I mean, I think that it's a topic that needs to be discussed more, and I'm happy that you were willing to come on. And one of our focuses today is going to be, or our primary focus is going to be on mental health in minority or communities of color or more vulnerable populations. I guess the first question I wanted to kind of, segue in with is, how do you see being part of a minority group? How do you see it contributing to increased stress or mental health issues within that population?
Well, when you read about statistics, because that's, what you learn in school, and you also see it in your community, that the majority of African American or people of color, brown, yellow, whatever the minority is, they tend to have a lot of disparities, whether it's economic, they make less. Black men make about $13,000 average less than their counterparts, Caucasian men. So when you think about just from an economic standpoint, you have to be able to afford things, to take care of your family, be able to afford to buy things, just maintain healthcare, things like that. So there's definitely increased stress when you worry about taking care of your home and taking care of your household. A lot of people are raised by single parents or, a lot of divided families. So there's a lot of reasons for people to have stress and, difficulties with mental health.
Mm-hmm. Mm-hmm. Okay. And how do you see the lack of resources or access to quality healthcare impact people or this population? Because what we can tell, at least right now in the middle of COVID, is we are seeing disparities in healthcare, and so we can't really deny it anymore as a country. And so how do you see that affecting also people, with their general health, but also their mental health?
Mm-hmm. Well, in the African American community, my experience, I've seen there's a lot of stigma with mental health, and people are leery of seeking out help and going to providers. There's a lot of history involved in that. We go back in time where there's mistrust, there's things that have happened to either family members, people were sterilized, there are people, Tuskegee reports, there's lots of reasons for people to be fearful of healthcare. So that's one barrier that we find. The other barrier is healthcare, having access to insurance. A lot of people are underinsured or uninsured, or, they have the bare minimum. So they're not able to do things like get dental care or, have their eyes checked. Just basic things are not done, and they're not prioritized when you have to pay bills or go to the dentist. It's not something that's prioritized, and that does impact health. It impacts how you perceive health. You may not perceive it as a necessity. It doesn't become a necessity until it is a necessity. Now you've got acute issues. So that's one of the things. It's knowledge. So one of the things I find, if people don't value, things like going to see a primary care doctor every year or taking that medication, especially if you have side effects from it and you've told the doctor and the doctor hasn't changed it, there's a cycle here of, not necessarily having providers listen to them, not having trust in the system, and also not valuing the system and, the benefits that you gain from it.
Mm-hmm. Well, and I also think about when sort of, like, I'll just use myself for an example, when I'm under a lot of stress for whatever reason in my life. And right now with COVID is a great example. I think we're all personally under stress with COVID, managing children, managing your job, whatever the case is. You find that that things that you may have prioritized before isn't a priority to you anymore. So I'm thinking on a regular basis, if you're having trouble with money, or you're having trouble with it within your workplace, or you're lacking resources, then your focus is on those areas where you're lacking resources and you're putting your energy there. So whether you make it to a dental appointment or whether you go to therapy once a week no longer seems like a priority because you're just trying to do the other things that you need to get by.
Absolutely.
So I think a lot about that right now, where a lot of us are trying to, manage all the different stressors going on, including our health. So, and you kind of touched on my next question a little bit. And I think this is interesting because I don't know the exact statistics, but I know that, it varies obviously from state to state, but often the percentage of healthcare providers, or if we just even think within mental health providers, race related to that of people coming in for treatment often don't match up. So there's more white providers than there are providers of color. So one of the things I was thinking about was, how does the lack of diversity in healthcare providers or in mental health providers specifically impact the trust and or perceived or real quality of care being delivered? And I think you touched upon this, but I'm interested to get a little more of your thoughts on that.
Well, there's no kind of blanket answer for that, because in some areas, I read in the news recently, there were a couple of women that ended up passing away after childbirth. So Black women are more, predisposed to having premature death as a result of pregnancy. And that is, there's a lot of reasons that could be behind that. Whether they were seeing a Black provider, white provider, I'm not quite sure. And I think I try to stay as optimistic as possible. And, you could match me up with 20 African-American clients, and it doesn't mean that my care is going to be any different than 20 other, non-African-American psych nurse practitioners. And I try to treat all my clients the same as far as, quality care. And I think that's what we need to strive towards. Whether we find a provider that matches everything we check off is not as important as if they match what we need.
Okay, so we were talking a little bit about the effects of there not being as diverse of a healthcare system of providers, and how that affects trust and perceived, or maybe real quality of care provided. And then we had a Wi-Fi issue. So if you wanted to talk a little bit more about that again, around, what your thoughts are on that.
And I mean, we know that there's definitely a deficit when it comes to having a diverse pool of providers that we can maybe refer if a client you may not necessarily think is a good match. But, you know, as I was saying, I definitely think that as a provider, you can have all of the, you know, population that is the same, you know, race or identified, you know, background as yourself. It doesn't necessarily equate to the care. It might help with understanding some of the issues, but
Sure.
I feel as providers, you know, we have a responsibility to educate ourselves, to train ourselves, to learn about the backgrounds. When a patient comes in and, you know, they are not taking the medications and they're reporting, you know, issues that you've talked with them 1,000 times about, you know, it's the time to say, okay, why is this happening? What is the reason for this? Instead of, you know, judging or assuming, but to really try to assess, you know, what you can do as a provider to help this client to get to a state of better well-being.
Absolutely. Absolutely. And interestingly, at Achieve, we just actually did with all our employees a training on unconscious bias and diversity and inclusion. And I think it's those kind of trainings that also help all of us to understand what maybe some of our own implicit biases are that might affect us as providers, because everybody has them.
Right.
And it doesn't make you bad if you have them. It's how do you become aware of them, and then what do you do with that, you know? So I think, you know, I think it's important for all providers to be open to that idea and figure out how to improve themselves in their work that they're providing. So I'll wrap things up with this. I was thinking about, what do you think, I mean, we talked a little bit about that, but how do you think we improve resources and cultivate, you know, culturally competent providers? How do we help? I mean, it's kind of a big question, but what changes do you think we can make within mental health to help people in these communities feel more supported or more likely to seek out help?
Mm-hmm. I think
I don't think you're going to answer like solve this problem,
no.
but just curious on some of your thoughts.
Yeah, I think we should elicit it from our clients, you know, because we can't just assume that, okay, they're African American, they're going to need this or they're going to need that. You know, everybody, even within the African American community, there's all different, you know, makeups. There's the Caribbean, there's African, from actually Africa. I mean, there's so many different diversities within cultures that you can't just assume you're going to know. So you want to talk to your client. You want to ask them to give you some of the information and, you know, continually assess how you're responding to their needs. And that may be, like you said, this training every year. This may also be having a network of other providers. I mean, every provider that you associate with should not look like yourself. You should have a broad, diverse, I mean, that's really, you know, the scope of your abilities is how diverse are you? You really should have a broad range of, you know, colleagues that you consult and, you know, appreciate their feedback and you coordinate care with. So
Sure.
There's lots of things as providers we can do and should do.
Right. And I think you raised a really good point. I think that one of the things I'm learning more about is, as I educate myself, is often within the white community, things are more individualized. And often in communities of color, things are more generalized. And so I think that you speak to the individuality of people of color and not just clumping people of color into one group, because we don't do that with all white people. And so I think there's having the appreciation of identifying maybe the racial background, but then within that racial background is a whole other different pieces of the person that make that person, different experiences that person has had in their life that have shaped who they are sitting in front of you. And so I think you speak to that in a very eloquent way, and it helps, I think, us think outside the box more. So, and that's what I was hoping to do by having this discussion. This is a much longer discussion than 20 minutes. And I totally appreciate that. But I think starting these conversations, putting them out there, and having other people maybe continue those conversations is my goal with these meetings. So I thank you for your time today.
You too. Thank you.
And thank you to all of you who are watching or listening. And I hope you all have a great week and take care.